pituitary because of a decrease in oxygenation can damage of all the hormone producing cell, and one of them is Chikan syndrome, which occurs with after a maternal hemorrhage. So therefore, how do we assess a patient with hypopituitarism? So again, meron tayong hemianopsia. So it is because of the tumor. And even patient can have a weight loss and emaciation. So there will be varying signs of hormonal disturbance depending on which hormone are being undersecreted. Like kung kulang tayo ng male hormone sa hypogonadism, then it can lead to either menstrual dysfunction or it can lead to infertility and the loss of libido for male. And then hypometabolism, okay, like your growth hormone. And then you have your adrenal insufficiency, so you have your aldosterone. And then you have your growth retardation, so this is your growth hormone that could eventually cause hypoproduction of your growth hormone, can lead to dwarfism. Now, sa babae, kung meron kayong hypogonadism, it can lead to the loss of armpit hair, buhok sa kilikili, and even pubic hair. And then decrease ang sex drive, infertility, even problems with the breastfeeding, regular or non-menstrual period. Sa lalaki, kung gonadal problem, okay, so there will be loss of hair on the face, on the armpit, or even the pubic hair, and even a decrease in the sex drive, infertility, and erectile dysfunction. So sa mga bata, the problem will be growth, including the height and sexual development. Okay? So, assessment. Okay. So, meron tayong headache. Alam na natin, disturbance of the signs of an increasing intracranial pressure. So, hindi kasama itong overview ha. Sa ano to? Sa hyperpituitarism. And then, hyperprolactinemia. So, it can lead to amenorrhea or oligomenorrhea. And then, galactorrhea and infertility. And in women, and the patients will have impotence in the men. Then you have Cushing syndrome. So, patient will visceral obesity, hirsutism, stria, hypertension, diabetes mellitus, and osteoporosis. Then you will have your growth hormone deficiency. So eventually, it can lead to a growth disorders in children. So ngayon, sa babae, so it can lead to amenorrhea in women. Then TSH deficiency, so patient will develop fatigue, may constipation, dry skin, laboratory picture of hyperthyroidism. And then corticotrophin deficiency, so there will be malaise, even anorexia, fatigue is real, pale, the symptoms of a very severe ordinary mild systemic disease, and laboratory overview of declining in adrenal function. Then patient can have vasopressin deficiency. So it can result to polyuria, polydipsia, dehydration, and unable to concentrate your urine. So this is your ADH or antidiuretic hormone. Okay? So dito ang affected ninyo ay your posterior pituitary gland. Corticotrophin, anterior pituitary gland. TSH, you have your anterior pituitary gland, and amenorrhea, anterior pituitary gland. Okay, so we move on now to the diagnostic test. Now, usually, patient will have a skull X-ray and CT scan or MRI. Now, X-ray of the cranium or the skull to see the dilation and erosion of the cilia turcica. Okay, especially when the patient have undergone surgery of the pituitary gland. Then even sabi natin, if that depends upon the plasma hormone that is decreased. Pwedeng decrease ang inyong thyroid hormone, pwedeng decrease ang inyong ACTH, pwedeng decrease ang inyong TSH, pwedeng decrease yung aldosterone. Okay? So we need to do your blood test. Now, the blood test that we may see, a very good example will be your cortisol. Now, pag may cortisol level tayo, so ang problema natin dito will be your ACTH, okay? Now, the blood test, so we need to monitor the blood test to check the cortisol. And usually, cortisol is stimulated by the pituitary hormone, ACTH, and it is usually highest in the morning. Then we can also assess for the thyroid hormone level. Of course, with the pituitary hormone levels such as luteinizing hormone and the FSH level and prolactin shall be assessed. Okay, so this may indicate if it will reveal a very decreased plasma hormone level, eventually it is a diagnosis of a patient having hypopituitarism. Now, therefore, we need to do a collaborative management. Now, we need to to have a specific treatment depends on the cause. Now, tumor, if there is a tumor, then we can have a surgical removal or irradiation of the. Okay. Regardless of the cause, we will include replacement and deficient hormone therapy. So this is the only thing that we can do with the patient. So we have your hormone replacement therapy. Now we need to replace your corticosteroids, especially for patients having problem with aldosterone and cortisol. Okay? And this is your ACTH. Now we need to give thyroid hormone if the problem is the thyroid gland. And then we need to provide the sex hormone if the problem will be your male and female hormone, your gonadotropins as usually given. So therefore, okay, the nursing diagnosis of a patient with hypopituitarism. So a client can have a disturbed body image related to the change in body structure and function of the body due to the deficiency of gonadotropin and growth hormone. Kasi guys, pagka ang patient nyo, mababa yung kanyang growth hormone, patient may have retarded growth. So your client will have dwarfism. And then ang patient ninyo, sa decrease in gonadotropin, so meron kayong infertility, meron kayong lack of hair, meron kayong tinatawag nating decreased libido, and then we have no menstruation, and even lack of ovulation. So all these things can eventually lead to a disturb in the body image. Then we have ineffective individual coping related to the chronicity of the disease condition. Now, it will be very difficult for the patient to accept the fact, okay, that they are having this special patient is having a growth retardation. So with these guys, okay, so what we can do, we will let the guidance, we will let the psychologist to come and talk with the patient at least to enhance the coping mechanisms and coping strategies for the patient. And even patients having this condition can lead to a very low self-esteem related to a change in the body appearance. And of course, we can tell the patient that the doctor is trying the best, okay, to do a hormonal replacement therapy to determine either the patient can improve with their condition. Then sabi natin, patient can have a disturbed sensory perception visual, so because of defect in the visual field. So related to impairment transmission of impulse as a result of suppression of tumor on the optic nerve. So katulad ng sinabi ko kanina sa inyo, your patient, if admitted, they need to have somebody with them. Okay? So kasi nga, they need to assist a patient for meeting the needs of daily living. As a nurse, we need to educate the relative. Sasabihin natin sa relative that the side rails up should be up at all times. Huwag natin pabayaang nakababa yung side rails kasi baka mamaya yung patient yung mahulog. Then as much as possible, we have to put, okay, the bed on the lowest position na kahit bumagsak yung pasyente natin, your patient will not get hurt. Hindi gaanong masasaktan. And then it is the responsibility of the nurse to educate the family members, okay, who is looking after the patient. Kasi pag may nangyari sa patient, you will not be held responsible as long that it is documented in the patient chart that you have educated the family member. There are times that the family members will not be around. Uuwi, then babalik. Now, if these things happen, now you tell the family members, okay, to